We are live, Dr. Jill.
Excellent.
I-
Hey, Dr. Jill here, and I am with my friend and colleague, Dr. Aimie. And, we want to talk to you a little bit about the upcoming Biology of Trauma Summit. And Dr. Aimie and I met a few years ago, and we both are somewhat avid cyclists, and she is dual boarded in preventative and addiction medicine, is really driven in helping us all understand and address the effects of trauma and emotions which get stored in our body. So Dr. Aimie, if you can tell us a little bit more about yourself and like what is going on with the upcoming summit.
Absolutely, Dr. Jill. Thank you. And yes, we still need to do our bike trip together that we've been talking about, I think, since we first met.
We do.
Yes, we do. I see your pictures of all the rides that you're doing, and I get very, very jealous, very jealous. So, yes, I've got a Biology of Trauma Summit coming up. And while some people may consider, oh my goodness, a whole summit on trauma, that's a heavy topic. I don't see it as something heavy because we have so many tools now. We have so many solutions for how to actually effectively address stored trauma in our body and be able to accelerate that journey. So a person's not stuck in therapy for years. And in fact, that's kind of the whole point of the summit is that, hey, this actually isn't our psychology. Trauma, life experiences becomes our biology. And so if we really want to get better, we really need to understand what are those ways, what are the specific ways in which stored trauma affects our biology. And so we need to address those. And I know that you see a lot of this in your practice, right? Like a lot of health conditions, physical health, mental health, emotional stuff is a result of this chronic stress that we go through. I don't know of one human being on earth that can say, no, I've gone through and stress, trauma. No, I've had it easy, right? Life throws stuff at us, and that those life experiences get stored in our body. And so I have this Biology of Trauma Summit on that topic. I've interviewed over 40 different experts on the different aspects that I needed for my health journey in order to address the stored trauma in my body. So my quick story is that I started out very conventional medicine practice, and I went to medical school at Loma Linda, where I also had a master's in biochemistry. I was very heavy science, Dr. Jill. I loved to be in my brain. I loved to think about things, and in terms of feeling, emotions, like no, that was not me. That was never me. And I was always very active, always physically active, pushing myself in whatever I was doing. And I adopted a foster care. He was placed in my home when he was 4, and then 9 months later, I adopted him. So he became my son, and he had clearly had some early life experiences that were very traumatic, very stressful. And I thought that with everything that I had been through, where I was at in my medical school training, that I had everything that he would need in order to get better. And I just knew that he would respond to my love, that he would be so thankful and grateful that he now had a stable home and someone who cared for him. And it was actually the exact opposite. He was still very much wired for survival. And it did not matter how much I loved him. He would not trust me. He would not let himself trust other people. He remained very, very on guard, very hyper vigilant, and still feeling, of course, then very unsupported and alone. And I could see this playing out. And so even with all the therapies that I was taking him to, it wasn't changing. And things got really bad. And so I threw myself into understanding what was going on in his brain and how could I actually shift that? How could I help him rewire what had become very, very strong attachment insecurity, attachment trauma, and rewire that for feeling secure, feeling safe in the world with other people, because otherwise he was going to have a really rough life ahead of him. And it was 6 long years. So when I talk about trauma, this wasn't something that I learned out of a textbook. This was something
Right.
that was my personal experience. This was my home. and threw myself into figuring out and studying and going to places and looking at the different experts, and finally finding the answers that he needed for his piece. And then my health crashed. So Dr. Jill, here I am. I'm now in a general surgery residency. Speaking of, picking a profession where there's no emotions, right?
Right.
It's all about being in the brain and being in your thoughts and really keeping yourself disconnected from your body to perform well. And I had a health crash. There was a moment where I could not get out of bed, and the chronic fatigue hit me so hard. So then that started my own journey. And here I am looking at some of my test results. My autoimmune markers are high. I'm overweight. I'm leaning towards going pre-diabetic. And I'm like, wait a second. All of these things are associated with this adverse childhood experiences and these ACE studies that are coming out. Why do I have these patterns in my biology? I can understand if that were my son, but no, this is me. And I had never, would have seen or related to having had childhood trauma. And so it started this whole new chapter of my life where now it's like my eyes were opened and I could see that, wait a second, it's not just the big T trauma stuff. This is actually life. This is actually so many of our life experiences that wire experiences that were overwhelming. And when we look back at our life, when we look back at our childhood, there were experiences that we went through that for whatever reason were overwhelming to us at that time, with the resources that we had, with the maturity level that we had at that time. It was overwhelming to us. And anytime we talk about overwhelm, well, that's a trauma, and trauma leaves lasting effects on the biology. When we go through a stress, the body can bounce back to its homeostasis and its prior state of health. And trauma is different from a stress. When something is traumatic, when something is overwhelming to our body and its felt sense of ability to respond to that threat or that danger, that's when we have these chronic effects on our biology that we may not see the full effects of those until 1 or 2 decades later, but it's been playing out this whole time. And finally, it manifests as either symptoms or disease. But if we can recognize ahead of time and actually find and discover these patterns, we can help our bodies get off of that track so that we don't have to go down the path that Dr. Aimie went down, where she had a major health crash and had to, by that point, there were so many things wrong with my biology. It took years for me to figure out all the pieces. And so that's what I'm bringing with this summit is, hey, here are all the different pieces that you can either, if you're all the way down that path where you're having symptoms, where you're having conditions, these are tools for you to get off of that. But if you haven't developed that far yet, but you know that you've had some hard life experiences, some experiences that were overwhelming, then knowing that your biology is on that path, let's get you off. And here are the most effective solutions and tools for that.
Right. Mm-hmm. And I think there's so many things that I could, delve into that you said, but, like one of the things, I think it's so imperative that this be, like just widespread at this point, which you're doing. You talked about stress and you talked about trauma. And like one thing that I talk with people about is like, it's really easy to see a motor vehicle accident, a major life event, like some of those things, like that's trauma. But one thing that you said that I think people need to understand is trauma it can be anything that is that sense of overwhelm.
Yes.
So it doesn't have to be a major life event. It could be, and I think that's where I think as people like realize like this has happened to all of us everywhere. And I think, some of my intro into this whole arena has been through dealing with chronic illness, because I've really realized like this is kind of that missing piece. We can get a lot of biology right, and we can get all of these things right, but there's some of these pathways. And and I think I often recommend people read The Body Keeps the Score,
Yes.
which, you know, like the first time I listened to it on Audible, like, I mean, I would just stop and I'd be like,
Yes.
oh my gosh,
Yeah.
you know, and I so I
Huge
think,
light bulbs going off. Mm-hmm.
yeah, and so
Yeah.
I think what's really important for people to know, and I feel like sometimes a lot of this has been kind of taboo, like we
Yep.
don't want to talk about it, and really, you know what, like this is all of us. This
Yep.
can be all of us day to day, pending where we are. I talk about a ladder, you know, where are you in your parasympathetic to sympathetic?
Yep.
You know, we deal with this all the
Mm-hmm.
time.
Yep.
And the matter is that with that just a stressor, you bounce back, you bounce back.
Mm-hmm.
Too many of these and you don't bounce back down. So
Right.
yeah, it's neat. We're
Mm-hmm.
seeing in our community, uh, firefighters are like
Yeah.
tuned into this now.
Yeah. Yeah.
I think of times when you and I trained, like there was a lot of stuff that was like, that's just your job.
It's just, yep. It's just how it's done. Suck
Right.
it up and get it done.
Right.
Mm-hmm.
And so,
Mm-hmm.
yeah, like it's just, I'm so excited about this because it is just so imperative. I see it each day. Uh, it's great when with a patient, we could recognize like, you know, you don't want to recognize there's this trauma, like not necessarily, but like when we really see the impact, and actually when you can see the impact, even on like lab results.
Yep.
And, you know, it's really neat to see because you know what it tells us is like we have more control.
Yes.
We have power. Each of
Exactly.
us individually can be empowered
Yep.
to address these things. And I think
Mm-hmm.
it's super cool.
Yeah, and I think that especially this last year with the pandemic and everything, I think that it brought to light how much this trauma stuff is right underneath the surface. That it doesn't take much for it to kind of pop out and make messes in our life. and when we look at coping mechanisms, right? Like coping mechanisms are an easy way to identify if we've had some of this stored trauma, because if you're noticing that you're going to anything to deal with emotions rather than being able to actually process that and sit with that, if you're going to food, like me, right? I used to over exercise, I used to overeat, I used to overwork, I used to, you know, do so many things in order to manage the emotions, and then it wouldn't take much for that stuff to just pop up because it was already so accumulated. So that's an easy way. But even with physical symptoms, as you were saying, you know, the nervous system is really what drives our health. And when we have a physical symptom or physical condition, and we have these trauma patterns wired into our nervous system because of prior life experiences that were overwhelming, it is constantly giving our body this message of danger. And it's no longer something that's external like it used to be. Now it's internal. And so we can throw all the supplements, we can throw all the medications, we can do everything. But as long as our own system is still wired for that danger response and the cell danger response, we've got our symptoms are going to be worse, and it's going to be much harder for us to get better. And it's certainly going to slow down our progress. So one thing that we always are looking at with this work is how do we integrate this stuff, right? Like how do we integrate medicine? How do we integrate functional medicine with this lens of trauma, and understanding that we really need to address both if we're going to get better and get better as fast as possible, whether we're working on the medical side of things or even on the trauma side of things. A person in therapy, right? If they're just trying to do the therapy without addressing the biology piece and the nutrient deficiencies that they have now, or the inflammation that they have going on, they're going to get stuck, because again, that inflammation is a sign for their body that, hey, we're still in danger.
Right.
Mm-hmm.
Yeah, I think, and like, as we both know, especially given the fact that we're both now like more in the functional medicine side of conventional medicine, you know, like that is just a massive missing chunk of every single day medicine.
Mm-hmm.
no matter
Well,
what
and
the diagnosis is.
exactly. A lot of people are telling me right now, like, I want to be able to go to a provider who can see my whole life and all of my life experiences in the context of my physical health. Like
Yeah,
they
makes
are
sense.
noticing that they can't separate that, right? Like, I know that these life experiences have affected me, and I want to see a provider who understands that and sees that, has that lens at least.
Right. And
Mhm.
the other important thing is for people to understand that these are neural patterns, these are pathways, these things are really they're built in like reactions of what
Yep.
we have. And it's how sometimes we can hear something or somebody says something and it kind of triggers something in you, that's a pathway.
Yep.
And there are things we can do, and through the summit we'll learn tools like
Yep.
what can we do to alter or impact some of these pathways. Because I think a lot of times people feel like they get it cognitively.
Right.
I'm not in
Right.
like I'm like you get that you're okay cognitively,
Right.
but to
Right.
understand that some of these things just happen, it's because they
Mhm.
really are patterns that
Yep.
start, and we've got to learn to change the pattern.
Yep. Yeah, and this is where, I've had to learn all of this by personal experience, right? Like, this isn't something that I got to, go to a classroom and learn about this. It's like I had to learn this stuff the hard way. And I had to learn the hard way that just changing my thoughts, or, trying to have a positive mindset, or doing some meditation is not actually rewiring my system. And what is rewiring my system is both this felt sense in my body of a sense of safety, a sense of security. It's not what my brain is thinking, because my brain can come up with all kinds of shit, honestly, Dr. Jill, right? Like, and my body is like, that sounds great, but we don't believe it, right? And
Right.
so it really comes down to the felt sense in my body, and that's what I have to go off. So during the summit, I talk a lot about the three states of the nervous system. One, you mentioned the parasympathetic, you mentioned sympathetic, and the other one is actually this freeze response. So people who are familiar with the polyvagal theory or that dorsal vagal nucleus, then you'll understand that we have this freeze response that is the third state of the nervous system. And so what I teach in my programs is how to actually recognize which of those three states you are in any given moment.
Right.
And when you recognize that, ooh, like, I've dipped into that freeze response, I'm in overwhelm, or I'm in sympathetic mode, then having the tools to know how you can shift that within a few seconds.
Right.
Now, what's going to happen is that it's going to go back to your default, right? If your default is more sympathetic, if your default is more overwhelmed,
Yeah.
5 minutes later, you're going to notice, oops, I'm back in there. But now you have the tools to it's like redirecting a 2-year-old, right? Like, oh, no, we're not going to do that anymore. This is where we want to be. We want to be in parasympathetic. And just knowing, like, giving people that ability to know what parasympathetic feels like
Right.
is huge, because most of the time they haven't spent much time there at all. They've either been in stress mode or they've been in overwhelm. They've been pushing themselves and, in this chronic stress, and even sometimes using caffeine in order to wake themselves up and get more stuff done. And then they have the collapse and the exhaustion and just kind of like the checking out and the zoning out, where they may be there physically, but there's not really much more there to them.
Right.
And they're not really in that middle parasympathetic state at all. They don't even know what that feels like.
Right.
So that's where we start with actually rewiring those patterns. But as we rewire those, we're going to get stuck if we have some of the biology pieces that are still unaddressed. And so we may need to do some testing. We may need to do some of the biochemical imbalances testing. We may need to do some nutrients and figure out what are the deficiencies. Are you having some of these common deficiencies that are normal for chronic stress and overwhelm, that we need to address that in order to make this other stuff stick?
Right. Yeah. I
Yeah.
mean, it's just like what it like we need little teams,
Yes.
lots of
Yes.
little teams that can
Yep.
help. Like
Yep.
you need a physician or provider that is tuned into this, somebody who else
Mm-hmm.
can work from a therapy standpoint, like so
Mm-hmm.
that we can
Yep.
you know, all work together. And, you know, I've given a little talk in the past on resilience, and really talking about freeze, which you talked about. And I think sometimes I find that people find themselves frustrated that happens, which is understandable.
Super frustrated.
Yeah, but also like just to help people understand, like that's not that's not under your cognitive control. So that is that overwhelm, and like where you can't even find words, or you can't. So
And yet, Dr. Jill, I will say that those people who, like, I have a 21-day journey, and I'll be doing a 21-day journey after the summit as well. And for people who are in that, we meet every single day for 21 days, and we're providing the support and the containment to rewire their nervous system. And what happens is that they get to the point where they actually can have that freeze response be a conscious choice for them.
Nice.
And so they're like right in the middle of what would be a normal trigger for them to go into the shame, go into the overwhelm, go into the collapse. And now they've been so building up their parasympathetic state, building up their resilience, that now in that moment, they actually have the choice. Right. Do I want to go down this path that I've always gone down before? Or do I want to choose differently? But it gives them that choice. And for me, like that's the moment of like, woohoo, like we've arrived, right? Like we've arrived at a whole new level of empowerment for you, that these responses, reactions that for you in the past have been instantaneous. There's no conscious choice. Now have moved to a place where you can choose like, is that what I want to continue to do? Or do I want to try something different this time? And let's try staying present with it. And let's try communicating through this. And let's try working through this. It gives them that choice with this type of work, which is super exciting to see that.
That is so awesome. So the summit starts the 19th.
It does.
And it runs through the 25th, correct?
Yes.
Okay.
So there are already 3 talks available. So I already have 3 talks available so that people, when they register now, they can already get started with that information. And the 3 talks, I've got Trudy Scott talking on anxiety and some specific solutions for anxiety. I've got Dr. Keisha Ewers talking about autoimmune personality and attachment, and how this, biology plays out for a few decades before it finally manifests in an autoimmune type of presentation. And then I have Dr. Peter Levine and talking about all of this, the stored trauma, the nervous system. He is the founder of Somatic Experiencing, what I have found to be the most powerful, effective therapy for trauma. And so those 3 talks are already available for people if they want to register now.
Awesome. And I'll throw links again below this, and post the recording and all of those things. So
good. Thank you, Dr. Jill.
Dr. Aimie, appreciate you. We will go for a bike ride. Just thanks so much for like getting this word out, because this is how we change medicine. Exactly. It's how we change health and wellness, and really how we can impact the world in a better way.
Yes. Well, thank you. You're doing amazing work, and I know that you're changing lives, and I really honor the work and the niche that you have.
Thank you.